Most of the time I faces a question from the clinicians and from the parents of autistic child that why should we proceed with the genetic testing when the doctors are telling that no specific medicines are available. We need to go through different symptom specific medicine and different therapies, so why should we proceed with the genetic testing? And now I can explain it in two ways. The first is for the management of disease and for the benefit of the affected individual, and second is for the family. So first, coming to the individual's benefit who is suffering or having the neuropsychiatric behavioral problem. Here, in case of specifically I'm talking about ASD, it's a spectrum of disorder, and the cause reason behind it is a multifactorial one. So genes of different systems as well as the environment interaction, this interaction is responsible behind the disease. So we need to identify precisely whether it is ASD or it is overlapping, that is comorbid with other disorder. It may be Fragile X, it may be Rett syndrome. Is a paper on Indian population where they have reported that Rett syndrome is very common in Indian population with the individual who are affected with ASD. So we need to identify whether the patient is having ASD as they are comorbid. So we need to identify, it may be Rett syndrome, it may be Fragile X. The first line of testing is Fragile X. If it's a boy and suspected or diagnosed with the phenotypic features, with the behavioral feature by DSM-5 that he is suffering from ASD, then first line of testing is Fragile X. Then we go for the ASD, and recently it is reported in from different case studies that whole exome or whole genome sequencing, the yield is better compared to the chromosomal microarray. We need to identify, it's mainly it's not a single gene disorder in most of the cases, but in case of Rett syndrome it is mainly MSCP2. In case of Phelan-McDermid, which is also overlapping with ASD, we need to see mainly the SANG3 gene mutations. In case of Angelman-Prader-Willi, we need to identify the CNV, it is CNV, or sometime it may be a single nucleotide change also. So we need to identify that the reason behind, what is the main genetic reason behind it. It is Rett syndrome, it is Phelan-McDermid, it may be Fragile X, it may be also some other like Down syndrome. In case of few DMD cases also, we observe this mainly the intellectual disability part mainly. So the overlapping phenotype, the inhibition of social interaction, repetitive behavior, and then social phobia, sometimes developmental regression, all these things, these are overlapping with many diseases. So for saving the time to reach the precise diagnosis, to reach to the perfect management of the disorder, we need to know, like if it is identified as Phelan-McDermid, then very recently, the gene therapy, Jaguar gene therapy, which mainly changes the SANG3 mutations. So the patient can identify with the Phelan-McDermid, and they can avail the gene therapy if they wish so. And with the time there will be more gene therapies will get the approval, but first we need to identify the disease to avail the drug, to avail the gene therapy. We need the perfect diagnosis. If the patient is identified with the Rett syndrome, then there is last year only trofinetide got the approval. So there are treatment, there are drugs, there are therapies, but we need to diagnose it perfectly, precise medicine, then precise treatment, then the patient can avail. This is one. The second point I'm coming. As the ASD, the heritability is stated to be 64 to 91%. The heritability is very high. And among the sibling recurrent risk, it is stated around 18.7%. The siblings are at higher point of getting the autism spectrum disorder. So sibling risk is high. So when the family is planning for their next baby, next child, they most of the cases, they wanted to identify that whether their next child also will be having the same kind of problem or not. So in that case, if the genetic problem is already identified in the affected individual, then we can go for prenatal testing. Prenatal invasive testings are there to avail, so they can plan for a healthy child without these disorders. So for benefit of the patient, for their precise perfect management planning, as well as for planning next child in the high risk individuals of the family, the first degree relative, they also can plan for their next pregnancy for a healthy child without this behavioral and neuropsychiatric problem. Thank you.